Hello everybody, I'm Greg Stock. I'm the CEO of Thibodaux Regional Health System. It's a pleasure today to spend a few minutes here with Dr. Aimee Moran. Dr. Moran is from this area. She's a family doctor that joined the staff of Thibodaux Regional Medical Center the last year or so. We want to introduce her to you and let her talk about herself. Dr. Moran.
Thank you, Greg. So my name is Aimee Moran. My maiden name is Landry. I grew up in Assumption Parish, and I came to E.D. White for high school in Thibodaux, so I'm familiar with Thibodaux itself as well. When I decided I wanted to go to medical school after I finished my undergraduate degree at LSU in Baton Rouge, I did my medical training at LSU in New Orleans and stayed in that area to do my family practice training at East Jefferson General Hospital, which is over there in Metairie for family practice. So our residency is a 3-year residency with rotations in all different parts of medicine. So as family practice, it's kind of what used to be a general practitioner. So know a little bit about everything to be able to take care of everybody. So we get trained from pediatrics to adult medicine to geriatrics, taking care of a whole bunch of different types of medical problems. So wellness visits, we manage diabetes and high blood pressure, we do small procedures if you have need sutures or if you have an abscess. Those are things that we can take care of. My dad is actually Dr. Landry, who has been an employee of Thibodaux Regional since 1994, I believe. And his example is kind of what I knew a doctor to be for my entire life. And so he was a big part in my decision to go into medicine, to choose family practice, and it's been a wonderful experience the last year to work with him, in our community and with our patients in that setting. So it's been a great year, and I'm happy to be here.
So it's great to have you. Frankly, in rural areas, there's a huge need for it.
Yes.
And there is there. But clinics in Paincourtville.
Yes.
And Pierre Park.
Yes, sir.
Beautiful area. Mm-hmm. And just seeing a lot of patients for primary care. Yeah,
so in addition to the general primary care, as a woman myself, as a mom now for the last year and a half, one of my interests was kind of more women's health. And so part of my family practice training is some time with OBGYN. That was a big thing, that as a woman coming home to my community, to be able to offer those services to our patients, because for people in Assumption Parish, a drive to a specialist is going to be either all the way to Thibodaux or to Morgan City or the Baton Rouge. So if I can take care of their routine GYN care, like ordering mammograms or bone density scans or pap smears, that saves them a trip, and it kind of builds that community. And of course, being able to refer when appropriate to the specialists who are, working closely with the group here at Thibodaux, hopefully. So
awesome. That's
yes,
a wonderful thing. There's a lot of travel disruption costs today. Travel costs are huge, and just makes it much easier. A lot of the people here, it seems to me, don't want to travel to New Orleans or Baton Rouge. They're so congested. So much traffic on the highways, and nowadays they're even dangerous, So that's been one of our things is trying to bring healthcare to the area. And we've had almost 40 doctors join us in the last 18, 24 months, which has been really great. And you're one of them, and we really appreciate you being here. Thank you so much.
Thank you, Greg.